Good morning. My name is Ifeanyi Zete. I am the one nursing student of Ontario Tech University. Can I get you to tell me your name
Awale,
and date of birth?
April 3rd, 2013.
Good. This morning I will be performing a respiratory assessment on you. Is it a good time to do so?
Yes.
Good. A respiratory assessment entails four different steps or stages. The first one is observation. I'll have to observe your anterior and posterior chest walls. I would also again palpate your anterior and posterior chest wall. The third step is that I will have to percuss your anterior and posterior chest wall, and then finally I'll use my stethoscope to auscultate your anterior and posterior chest wall. So I'll begin by inspection. I'll inspect and observe that you are breathing normally. The rise and fall of your breathing is symmetrical. I also observe that you are not having any form of respiratory distress, which means maybe difficulty breathing or use of accessory muscles. I see that you are breathing normally, rise and fall of your chest is symmetrical. Then I would again look at your breathing pattern, breathing rate, the reading. I'll also look at the skin color of your chest. I see that it is consistent with the color of other parts of your body. I will look at the anterior posterior transverse diameter. I see that it is approximately 1:2 ratio. Again, I'll look at your rib cage. I see that your rib cage is sloping down bilaterally symmetrically. Both of your left and your right ribs are sloping down symmetrically. We now move to palpation. I'm going to palpate your anterior and posterior chest wall, as I said before, and then in palpation I'll be looking for expansion of your chest wall, or see how it expands. I'll also be looking at tenderness, and then I'll also be looking at the tractile frenitus. So when I palpate, I'm going to ask you to take a deep breath in and breathe out, front and back, and then I'm also going to ask you to repeat after me when I say 99, okay? So you're going to breathe in, breathe out, again, breathe in, again. I see that the chest expands and contracts symmetrically. If it does not expand and contract symmetrically, it means that you are having a bit of difficulty in your lung expansion. Then I'm also going to look at I also see that there's no masses, no tenderness. I'm going to palpate your posterior again, and then ask you to repeat after me. 99,
99,
99,
99,
99.
99.
I see that it is your tractile frenitus vibrates normally, so you don't have any issues with that. I'm gonna percuss your anterior and posterior chest wall for resonant sound. And I'm gonna start from posterior. What I got was a resonant sound. If it is hyper resonance, it means that maybe you have trapped, in your lungs. And then I'm also gonna auscultate. For breath sound, I'm gonna start from your anterior wall. Breathe in. Breathe in. Again, I'll auscultate your back. So when I auscultated, I see that your breath sound is normal. I heard normal breath sounds. I was looking out for breath sound like wheezes, crackles, which would have indicated that maybe you have fluid or mucus in your mucus or some kind of obstructions in your lungs. Is there any other thing I would do for you?
No.
Okay, thank you so much for your time. I would document my findings and report it to my nurse in charge. Thank you.